Happy Friday and welcome to At Home and Health. Each week we aim to uplift and support wellness professionals working from home during quarantine by providing interactive conversations with experts on today's timely topics. I'm Amanda LaPlante. I'm the host of Get Real to Heal on KWRH 92.9 FM, and I'm lucky enough to join you today to lead the conversation. I'm also an integrative nutrition health coach, so that's a little bit about my background. Before we start our conversation with our guest experts, just a quick shout out to our sponsors and organizers of this series working hard behind the scenes. Casey Limmer and Kate Burris of Gateway Wellness Associates and Jessica Turee of Acadia Healthcare. We are so glad that you are here with us today. Want to cover a little bit of conversational etiquette. We want to be interactive in this experience, and we love your questions and comments. So if you'll just pop those into the chat, we will make sure to get to all of those during the conversation with our expert. And you're welcome to raise your hand and come on screen with us if you have a question and you want to interact directly. Just be aware that we are being recorded, so you'll be on camera too. And today's topic is pharmacy in a new era. I always like to ask Jessica, Kate, Casey, is there anything that you're looking to ask in particular in today's conversation?
I'm always interested to know more about CBDs and cannabis because it is really, I mean, obviously in Missouri, which is where I am right now, we're just getting some logistics ironed out, and I have clients who are interested in how is that going to be helpful for them. People are highly anxious right now. I don't want them overusing. But I want them to be using responsibly. So I'm looking for, I always love when Kelsey talks about that topic.
Awesome. I know a lot of us are really interested in hearing more about that. So tell you what, without further ado, let's jump into that conversation. Dr. Kelsey Schwander is joining us today. I'd love to introduce her. She has created numerous clinical programs, including health travel, naloxone, hormonal contraception, smoking cessation, and point of care testing. She was the first pharmacist in the state of Colorado to prescribe a hormonal contraceptive to a patient, which was, that is big for a pharmacist to prescribe. It's amazing. Dr. Schwander and her husband recently relocated to St. Louis, and she continues to be a clinical pharmacist remotely for Good Day Pharmacy out in Colorado. And she's also working at a local pharmacy in St. Louis, in addition to having started in 2019, Be Health Consulting, which is a healthcare consulting company focused on empowering patients, providers, and businesses to create healthcare solutions. She also has her clinical cannabinoid medicine certification. Ooh, that's a mouthful. And is experienced in discussing cannabis with patients due to her past clinical work in Colorado. Welcome to the conversation, Dr. Schwander.
Oh, well, thank you for having me. I really appreciate it.
Yeah, so excited that you're here. And we do have another pharmacist that may or may not be joining us. He's having some technical difficulties. So if Steve Zielinski hops in, we'll jump over to him and make sure that he gets a proper introduction as well. But I'm excited to learn more. I guess, we could start with CBD and cannabis. It seems that's the hot topic and the buzz topic, and then double back to a few other points of conversation. You can get CBD anywhere right now. Should we be worried about quality, and is it safe as a supplement? Share your wisdom.
Yes. So yeah, CBD is everywhere. So just a little background on it. So in 2018, the Farm Bill legalized industrial hemp, which means you could cultivate hemp that had products that were less than 0.3% THC. So that's why we saw this huge boom last year of CBD. You see it at the gas stations, you see it at Sephora, you literally can get it anywhere. And right now, especially, I know a lot of our patients and all of you are getting bombarded with things online. And yes, so CBD or cannabidiol is not created equally. You should definitely be careful. So we can let's go over the two, because there's different types of CBD the forms that are out there, just so you have a little background if you're curious yourself or if you get patients asking questions. So you may have seen like broad spectrum or full spectrum CBD or isolate CBD. So the cannabis plant has over 4,000 different compounds in it. And so THC, which is the psychoactive part, that gets you the high feeling, and then the CBD, which doesn't get you the high feeling. And so those are just two of the many compounds in the plant. So when you see full spectrum CBD, what that means is that there's the THC in it, but it's supposed to be at that 0.3% or lower. But it has different cannabinoids in it as well, which is good because they all work synergistically together. So it's really kind of the most natural form of CBD that you can get. The other form, which you're seeing more and more of, which I'm seeing a lot of companies start new lines of, is isolate CBD. So isolate CBD is they extract, it's the purest form of CBD. So there's supposed to be no THC in the product. Again, these aren't very regulated very well, so that's where the concerns come in. But with isolate CBD, if you're concerned if you get drug tested at your work, this may be an important question for a lot of our patients, that for full spectrum CBD, you can test positive for THC because of that small amount in there. So I always like to tell people that because, I have patients who take and they're like, oh, I would never test positive. And I'm like, wait a minute, you can test positive. Yeah, so that's kind of the background of the CBD. And then we can kind of go into, should I buy it online? Does anyone have any questions about that before I kind of jump into the next?
I'm not seeing anything in the group chat yet, but I will tell you I have a follow-up question to that. So you mentioned that with full spectrum CBD, it's actually the most natural, maybe might even be just in many terms or in many ways the best form because it does have both components. But, then of course the negative aspect of possibly testing positive for THC and in a mandatory drug test, et cetera. So, do you see any changes in testing happening in the future? Any changing in threshold, anything like that as the efficacy of this comes to light?
Yes. So, that is the, $100 test, the $1 million test that everyone's trying to create right now. So the problem when you test for THC, and so just for THC, so if you smoked today and had cannabis, or you had it 2 weeks ago, you're still going to test positive. So the huge problem is that you don't know if the person's using it right now or not. Or, for example, if they're using CBD that barely has any THC in it, there's no test to do that right now. So the answer is right now there's not, but definitely I see in the future just because it's becoming more studied. CBD is being used in almost every single state. They're finding, better efficacy for it for different disease states. So hopefully in the future, they'll be able to start testing, different parts of it so they can have different tests for that.
Gotcha. All right. Well, we'll be looking forward to hopefully seeing some changes there. That would be amazing. Now, is the full spectrum, we've got a few questions popping up over here. Shannon wants to know, is the full spectrum enough THC to make a person have any sort of feeling of being high?
So no. So again, anything that's sold, it has to have less than that 0.3% THC. Now, with that said, this is an unregulated product. So we have to understand it's regulated just like a vitamin, which, it's not regulated very well. So you really want to be careful. And that's another question I get a lot is, where should I be buying it? How can I be careful? And so, I tell all my patients and people want to use it, use common sense. Like, do you buy your, medication and supplements at a gas station? No, I hope not.
We hope not.
So, don't be buying your CBD at a gas station. Online, there's so many things online right now. And with the quarantine, I've had a lot of people asking. I'm still very skeptical of CBD products online unless you know the company or what, someone who's selling the product. So, and obviously I'm biased because I'm a pharmacist. But, my, biggest recommendation to people is go into the pharmacy and ask the pharmacist. We've done all the work for you already. We know the products that are on our shelf. I'm, biased to independent pharmacies because that pharmacist, is the one who probably picked out the product to sell in their store. And so, don't do all the research online. There's so much stuff online that's, bad information. And so call us up. That's what we're here for. And we can, go over the products with you. But I would say for, if someone doesn't want to call their pharmacist, the two things you really should look for on a product is whenever you buy a product, on the back of it or somewhere on it, it should have a lot number or a batch number. And what that means is they make a big batch of it and it has a specific number that you should be able to go onto that company's website and look up. It's called a COA, or Certificate of Analysis. And that's just a lab testing what's in the product, what pesticides were used, were they within, the specific range. And so if a company doesn't have those two things, the batch or the lot number, or they have access to the Certificate of Analysis on their website online, I say don't buy the product. There's too many things out there that, could be snake oil. So, if you want to do your homework, that's definitely it. But my recommendation is call your local pharmacist.
Sounds good. Now that makes a lot of sense. And I love that you brought up independent pharmacies and the fact that you really have an intimate connection with and knowledge of the products that are supplied there as well. I think that's a tremendous point. We do have Steve Zielinski, who has been able to get on. I see you on video, Steve, but I'm not able to unmute you. Can you unmute your, oh, there we go.
Yeah, I can do that.
Well, I want to jump over and give an introduction of you as well. So Dr. Steve Zielinski is the owner of Webster Pharmacy, an independent pharmacy located in Webster Groves, Missouri. Prior to opening his own pharmacy, he headed up a pharmacy for Centerpoint. He's a functional medicine pharmacist with advanced training in bioidentical hormone replacement and an expert in drug-induced nutrient depletion. Welcome to the conversation, Steve.
Oh, thanks for having me.
All right. So, and you know what? You've been my pharmacist for, you were my pharmacist for years ago at Centerpoint, and now, of course, we've worked together quite a bit. So I apologize. I will be referring to you as Dr. Zielinski going forward. I threw the Steve in there. And Dr. Schwander, if I throw out Kelsey, I apologize for that as well.
That's okay.
So we were having a conversation about CBD, and there are some more questions coming up in the chat. So I want to jump over to those before we move on to any other conversation. So we've got a question from Casey. Are there dosages of either kind of CBD, and what levels are considered therapeutic?
So that's a very tricky question because, again, there's not a lot of studies done with CBD. It depends what people are using it for. My recommendation, without diving too deep into it in different disease states, is look at the recommended dose on the product after you've done your homework. It's a good product, and always start at the lowest dose. With most medications, you want to start off the lowest dose and slowly work your way up. Because if you want to use the less medication that you can, there's less side effects. So yeah, that would be my recommendation, because there's all kinds of different disease states they're experimenting with and different doses. I will say though, the CBD that's being used for seizures, that's at much higher levels, and that's something that you definitely want to have a conversation with your doctor about.
Okay, and so definitely we know that there is some efficacy for seizures and many other situations. We have a question from Kelly about, does CBD help or hurt depression?
That's a good question. So the studies that I have looked at, they've kind of been, there's no really great conclusion from them. I haven't seen that it hurts patients. I've more seen that it really doesn't do much for depression. What I have seen, there has been some really good studies that are coming out for anxiety, actually. So they actually did a study where they took patients and they made them do public speaking. And then they took the same group of patients and they did different measurements and gave them CBD before and did the public speaking, and they had drastically lower levels of anxiety. So I would say for me in the pharmacy, I see patients use it for anxiety. And then I would say a lot of my patients are using it for sleep. I have looked at a lot of the studies for insomnia. And again, they're really wishy-washy, but what I found my patients telling me, so no studies behind this, just from what I hear from my patients, is that when they take it for sleep, it kind of calms them down before bed. It doesn't really help them fall asleep, but a lot of people, are in their minds and we overthink before we go to sleep, and it kind of helps get them to sleep.
Okay. And
one thing is it might not really help with CBD or with depression. One thing that we've done a lot in the pharmacy is add fish oils on top of SSRIs or other depression medications. And we've had a lot of success with that with kids and adults. So I don't know what it is, but it seems like if like it was working. Like we have a lot of patients that will come in, they're looking for something extra for their depression or anxiety. And it seems when we add fish oil, they don't need a higher dose.
Okay. Good to know. And you know what? So this is interesting. We had a question in the chat box. Have you heard of people using CBD for anxious pets? Any thoughts on this? And I want to say before, I would love, of course, your take on this as pharmacists, although you're probably not pharmacists to many pets. Maybe you are, I don't know. But I had a dog who was aging and had seizures and a lot of anxiety. And I was able to successfully use CBD and fish oil as a combination actually for him. So now I know you didn't necessarily mention there using fish oil on top of CBD, but coincidentally, that is something that after my own research, I was able to find worked really well for my pet, which ties into the question that that Jessica had here. Any thoughts on using that in pets? Or
we use it and we recommend it for pets for arthritis quite a bit. With for CBD, I've had a lot of patients have success with CBD in their pets for arthritis actually.
Yes,
so
I would second.
Yeah.
Oh, go ahead, sir. Yeah, I would second that. I think I have a lot of patients who had a pet with arthritis. And one patient in particular had a 12-year-old dog that, you know, had a hard time getting up just to even eat. And they started giving it CBD, and they said it was like a whole new dog. I haven't seen it so much for anxiety, but definitely for arthritis in pets.
Okay. And we had a question in here from Casey. Is there a particular brand that either of you trust? What do you carry in your pharmacy? We can start with Steve. Sorry, Dr. Zielinski. I'm going to get this.
Whatever, Steve, it's fine. So, you know, I carry stuff that people tell me works. And, you know, and sometimes I see things fall off and it'll work for a while. I know we carry like Charlotte's Web. We also carry, we've done really good with, we have a lot of people that have always come back requesting topical CBD. So I look for products like combination products for pain, like topical, like, you know, I found one that has CBD with lidocaine. I have CBD with like your, kind of like a Bengay mixture with CBD. I mean, we sell a lot of topicals mostly because people are so scared of like, what is it going to do to their system? They don't want to get high, or their fear of getting high, I guess. So that's kind of, we've done a lot more with topicals because, I mean, some people swear by it, especially when they have like arthritis in their hands, in pain in their hands, they can feel that right away. So whether it's the CBD working or it's the menthol and camphor, I don't know, but the combination seems to work and people keep buying it.
I hear that with my own family members. And Dr. Schwander, what's your opinion on that?
Yep. So I see a lot of patients, use topical as well. I again, prefer people to use topical first if they are trying to use it for that. And then, because I always tell this to patients, you know, once you put something in your mouth, it has to go through a lot of different systems and it affects the body, you know, differently. So yes, definitely topicals. About the brand, you know, there's lots of different brands out there that you can look up. We use a lot of Bee Leaf, which is actually made in Missouri. I know they got approved for a lot of dispensaries as well. So I know that company does a good job. They have a third party who tests. But again, there's a lot of really good companies out there.
All right, awesome. And we also had a follow-up question. Any particular fish oil? Would love a brand recommendation, says Kelly.
I think the two primary ones I use is like Orthomolecular 820 or like a Nordic Naturals professional line. But usually I'm looking for really, really high dose DHA or high dose EPA in both.
Okay, good to know. All right, and moving on, we are amid a very interesting time in medical history, right? And just in general with COVID, and a lot of people are looking for ways that they can boost their immunity and support mood. I'd love to know the take from both of you on some supplements and approaches that you're recommending for immunity and mood boost during this time. Who wants to start? Both so excited. Sure, okay. Dr. Zielinski, jump in.
I guess I'm jumping in. Okay, so I think Well, it depends if people are getting outside or not. So I think like with COVID-19, it's really interesting. But since I do a lot of stuff with like functional medicine this time of year, it's kind of a double whammy, I guess, right now is like using quercetin orally. Like whether it can prevent or treat COVID, I can't say, but it's really good for allergies. And quercetin, as you know, is like a mast cell stabilizer. But also against like cancer cells and other things like that, it can act as a zinc ionophore. And what a zinc ionophore does is in cancer cells, it can actually open up the cell wall. So then if I can combine that with like an oral zinc supplement, zinc's really good for colds. So a lot of people are buying zinc for colds because it can once again and what it does, what it has been shown to do against like SARS virus, not maybe COVID exactly, but like against previous strains of SARS, which COVID's like kind of in the same family, it stops the mRNA transcription of the virus replication. So a lot of times I've been recommending, honestly, just like DHIST and zinc.
Okay, and DHIST, of course, being a product of orthomolecular biotics.
Yeah, and if I can get, sometimes I can't get quercetin, so I'll find quercetin from a different manufacturer, or just tell people eat a lot of apples. So it's in your apples. So
apples, and I think onions too, right? Am I mistaken on that one?
Possibly.
I'm one of those weird people that loves raw onions. You guys won't want to hang out with me in person. It's better through a screen. Garlic and onions, love it.
That's kind of what I've been recommending.
Dr. Schwander, what are your thoughts on supplements and approaches to boost mood and immunity right now?
Yeah, so, kind of what Steve was saying is there's nothing really out there that's going to cure or help prevent COVID that we know of yet. I agree, I recommend zinc a lot. It can help, prevent upper respiratory infections. So that's always good to add on. Vitamin D can also help fight respiratory infections. And vitamin D really is if you're deficient in it. And a lot of people are, they don't realize. So just, adding that on can't hurt. But those are my two big ones. I get asked a lot about, vitamin C, which again, we see vitamin C more with the common cold. We have to remember that, this is a virus. So I don't think there's great outcomes with vitamin C. It's not going to hurt someone if they want to add vitamin C. But yeah, those are kind of my two go-to right now, or, vitamin D and zinc.
Awesome. All right. Well, really good to know. And we're running a little short on time. We got about 5 minutes left. What I would love to dive into, given the majority of the folks that are on the call with us, psych medication. And many patients have increased anxiety and depression during this pandemic time, isolation, lots of other factors, of course, affecting that. But how do you know when to increase a psych medication during this time? And is there a concern of tolerance? That was one question that we had to pose.
For me, at least, I think that's definitely a discussion that needs to happen with the physician and the patient. It's very common during, stressful times, during the pandemic with people in jobs. I have been seeing a lot of psych medications, their dose increase or, something being added on, especially when we're being quarantined and we can't see a lot of our patients. I have found that just increasing the dose versus adding a med on, if that is, if they're on a dose that you can increase, is really beneficial. Because usually then, after the stressor, the pandemic, or, when things start to come back to normal, it's easy to kind of titrate that person back down to their regular dose versus adding something on. But I've seen, a lot of successes with, adding on like Wellbutrin, because it works differently than a lot of SSRIs and SSNRIs, which a lot of people are on, which can be beneficial to patients as well.
Dr. Zielinski, do you have anything that you wanted to add to that?
Yeah, I just still go back to my fish oil. And then I guess I'm still a big fan of fish oil because I've just seen what it can do for people before COVID with psych or mood disorders and stuff like that. So, and in that situation, I would just use I'd go towards a higher dose DHA versus EPA. I mean, I kind of stick with that. I don't know. I've just seen pretty amazing like turnaround stories for people with psych issues before COVID hit, that when you gave them a high dose DHA, specifically, like their doctors were reducing their dose of their psych medication. So I wouldn't see why that would stop working just because COVID's here.
Fair enough. Well, and one of the things that I really respect about you is having known you over the years. When I first met you, I was seeing a psychiatrist at Centerpoint myself for bipolar, anxiety, ADD, the gamut. I think I was taking 5 different medications at that time to help with those disorders. And having gone the integrative and functional route over the last few years, worked on my gut health and done several other things, I am now on 0 medications for any of those disorders, sitting here holding this conversation with all of y'all every week without any aids for my ADD. And it's just really interesting to me how many times, are we missing a nutritional deficiency or perhaps a underlying hormonal imbalance or some other sort of what some MDs are now calling psychiatric pretenders that we're medicating for, whenever really there might be some other modification that needs to be done. And that's what I love about integrative and functional pharmacy, which you're now, you now own a functional pharmacy. And I think that's very, very cool. I'd like to touch on hormonal health and mental health. You're an expert in bioidentical hormone replacement as well. What's the connection between hormone health and mental health, if you could sum that up in 60 seconds?
Oh, geez. I don't think you can sum up anything with hormone health in 60 seconds, let alone that with mental health. But
I guess just
I think it's just that cortisol levels and that stress. And, the biggest connection that I see a lot of times is that people are stressed out, and we try introducing like more estrogen, it gets worse. So it's very important before I try adjusting hormone levels, I guess, to make sure that they're, actually eliminating them properly. So making sure we're testing to see how somebody can eliminate estrogens. Because under stress, your body produces more estrogen versus testosterone, right? So if you're going to produce more estrogens and you introduce more estrogen into it and you can't eliminate it, then that puts people at a higher risk for breast cancer. And they're stressed out, and then the hormones really don't work. They just feel worse. So I think it's, hormones and stress. I think, the one thing is looking at cortisol levels and making sure the cortisol levels are normalized before introducing estrogen into somebody with, either way, with or without psych issues. But I mean, psych issues come along with menopause just because you're reducing that estrogen level. And I get that. But then the cortisol just, it'll affect the way the estrogen's metabolized.
Yeah, and that was a great job summarizing in the time given. Thank you. I think we could have a whole another conversation with both of you about various different topics. You're such amazing experts, and we feel so blessed to have had you here with us today to share your knowledge. Thank you for that. I'd like to finish up with how people can reach out to you or find you to stay connected or get more information on what you do. We could start with Dr. Zielinski since you're on the screen.
Oh, so I'm on the screen. Well, we've got a website, Webster Pharmacy or WebsterRx.com. And if you can navigate it, it's kind of tricky to navigate.
Well, it's only been you
can
just opened
contact
that new location. You've been in that new location, and with the new branding and everything, you're still getting through all of that. It's been since just a few months, right?
Yeah, we moved beginning of March.
Okay, it's an exciting time. So yeah, WebsterRx.com, correct?
Yes.
Awesome. Thank you so much. And Dr. Schwander, how can people find you and stay connected?
Yeah, so you can just go to my website, which is B Health, and it's just the letter B, healthconsulting.com, and all my information's on there, and the different talks that I do. And yeah, if you have any questions, I do help a lot of patients one-on-one, but I do help a lot of providers, and I give a lot of lectures. Lately I've been doing a lot of cannabis lectures just because of the new law in Missouri, and I'm from Denver, so I have a lot of experience with it. So.
Well, it's an exciting time. It's definitely a new era in pharmacy, and we're lucky to have thought leaders like the two of you right here in the area. Thank you so much for joining us today. And I'd love for Casey and Jessica to unmute themselves and come on screen. This is our last planned episode in a series that we've put a lot of work into behind the scenes. And I thought maybe you would like to share a little bit about what's next.
I'm really looking forward to what's next, and I'll let Jessica talk a little bit about it, because this was her idea that she came to me with, and I think it's going to grow. So we are really excited to be able to offer some continuing education workshops, online webinars, because we want to keep our community together. But it's really going to be focused on this idea of functional medicine and multidimensional wellness. And so I'm really excited that Acadia is going to be sponsoring those. CEs are going to be included with those for free. So thank you to Jessica, and I'll let Jessica say anything else she wants to say about that.
Yeah, I was just going to say, you know, more to come. Stay tuned. This was a good kind of springboard, and we've had some really incredible speakers, and we appreciate the attendance. Each week has seemed to grow. And so, you know, Amanda, Casey, and I are having more conversations about bigger events, and, you know, next year really being able to get in person and grow the networking piece as well, so that we know when we're working with clients that we have something like a functional medicine doctor or pharmacist to reach out to when these things come up in our practices, and so that we can really treat the whole person. So I'm grateful for all of you for attending, and Casey and Amanda, thanks for being such a great team to work together with.
Absolutely. And likewise, got to say thank you to Kate Burris. She's done a great job behind the scenes as well, pulling things together. You three have just all been amazing to work with, and I'm so excited for what's coming next. I know that it's going to benefit a lot of people and grow and expand a lot of minds and relationships and connections, and I'm so grateful to be a part of it. With that said, and without further ado, we will go ahead and say goodbye on the At Home and Health series. Maybe we'll resurrect it someday. It's been an absolute pleasure. If there's anything we can do to support you between now and when the next phase starts, don't hesitate to reach out.